Hi, my name's Greg Felt. I'm Director of Public Health in Sheffield, and this brief clip I'll talk about the wider effort to protect health and to minimise illness and death through coronavirus, and how we've done some of what we've done. So you've seen that the press is quite rightly full of wall-to-wall coverage of the outstanding efforts that the NHS has put in the name of saving lives. It continues to do that, and long may that be the case. I'd like to just put a bit of broader context and framing around that. And in this, I'm not necessarily, no, not at all seeking to diminish the work of the NHS, but to highlight a much wider group of people who have enabled the lockdown to happen, and in doing that have doubtless saved countless lives. So our broad strategy was about fivefold: to minimise the potential health and then the social and economic impact, to keep a strategic overview of the whole response, to maintain public trust and confidence, and to protect the safety of responders. That was the strategy, that is the strategy. So and lots of people well beyond the NHS have contributed to that over the last 5 or 6 weeks. So in no particular order, and I won't name them all because there are many of them, but firstly, Public Health England were involved in this way before anyone else thought it was going to be a big deal, and they were doing contact tracing in what was now known as the contain phase of this epidemic. It was an amazing effort, and it bought us at least a month to prepare. It bought the NHS a month to prepare for the intensive care capacity that was needed. Our environmental health officers have used a range of legislation to close down businesses, close down parts of the economy that the government indicated should close, and to enforce social distancing in others. The police have quietly and sensibly and effectively educated and occasionally enforced social distancing in our communities. Local government and the voluntary and community sector have put in a Herculean effort to provide community-based support to those who need it, both those who are shielded, but a much wider group of people as well. Our IT teams have done a massive effort to switch our way of working so that we can continue to provide as much business as usual as we want. So there are many people and roles I'll have not mentioned in that, and I can please we'll keep adding to that. But in short, the collective efforts of local and national government and many others outside of government have enabled the lockdown to happen, enabled the lockdown to save the lives it did. We will never be able to count those lives, but we know it did, and that we know that work has also enabled the NHS to keep running in a way that it has over the past 6 weeks or so. It's been a public health crisis, no doubt about that, but that doesn't mean that I've done all of that stuff. The city and all of its institutions and all of its agencies across public sector, private sector, voluntary and community sector, the faith sector, have all contributed to a big group effort, and by doing so, we've saved far more lives than would otherwise have been the case, and thank you for that.